what
Now,
it says.
yesterday, we saw Jen Fred try to kick a ball through a goalpost. It looked like that punter.
Today?
Here's my thing. I tried to kick a ball, but I had high heels on. That punter guy did not have high heels on. Today, I'm going to freeze your fat off. Not me so much, but Dr. B. You're going to freeze the tummy off. We want to get rid of it.
Yes,
and this lovely, lovely lady who looks very close to perfect, you're going to turn her into perfection right after the break. Don't be nervous. I'm going to lead you through and I'll hold your hand the whole time.
That's the most important part.
But if you eat too much pizza, you're going to put on fat. One way to get rid of it, you freeze the fat right out of you.
Yeah, so a lot of people are afraid of, you know, the hardcore surgery or something like that, Jen. So how do you just freeze it off? And then where does it go?
Okay, so we're going to answer all those questions as we're doing this. You're going to be fine. You're going to be fine. This is called Coolsculpting. And we've done segments on a version of this from before, Zeltique. It was a smaller piece.
Yes.
So, Dr. Bernstein, people had to come in and have a couple different areas done. The new thing is that this big honking thing is going to make you look like a supermodel in one time instead of several treatments, correct?
And in fact, the patient we had on before, you know, with the side there, he's here today. It's the 2nd anniversary. One side's still down. The other side's not looking too good.
Okay, so as Dr. Bloom puts the device on her tummy, basically she's going to have this on for about an hour, right?
Yes.
Okay, so we're going to watch as you do this. And everyone asks the same question. Where does the fat go?
Well, the cells disappear by a process called apoptosis, and they disappear over a period of time. So basically over a couple months.
Can I have a seat now?
You can sit.
So she's sitting down. So over a couple of months, basically it freezes them and then kills the fat cells?
They die over a period of months. And what's cool about that is it's so gradual. There's no loss, and there's no increase in blood lipids, and it's just a very gradual process. So it's really, you don't even notice till one day you look down and it's gone. And once the cells are gone, they are gone for good.
They don't come back on my elbow, my shoulder. They're not going to come out of her ear or anything like that?
You know, this is a localized area. This is a small area. It makes a big difference in your appearance, but it's not a big percentage of the fat in your body.
Okay, so we're going to come back in an hour because this takes about, she'll sit here, she'll have a little magazine, a little something, something.
Yeah, people hang out.
And then we'll come back in an hour and we're going to be able to see basically the cells that you've frozen, the cells that, right or no?
Yes, it looks kind of like a giant stick of butter. When you cool fat, it gets kind of hard, right?
Yeah.
And there's a 12-degree difference between where you can injure fat and where you can injure skin. So Coolsculpting exploits that difference and makes it so we can injure the fat.
Temperature
without
degree.
anything else. Yes.
Okay, awesome. Good luck. I won't harass you for the hour unless you need me to read Us magazine or something. So coming up in the next hour, what you'll be able to see, Mike and Chanel, the stuff that was in there. And then again, basically over time, couple months, she might, you know, her body naturally gets rid of it. And then, so it's at 8:45, we'll show you that. And the other thing we're going to show you at 8, Dr. Bloom has this really cool stuff. Basically, FDA has cleared something to put in your lips to make you look awesome. Not Lisa Rinna.
Yeah.
Yeah, like really good. So we'll be doing that in an hour.
Does she feel cold? I mean, does it actually feel
Do you
like
feel cold?
freezing? Does it hurt?
No. No, does it hurt at all?
No.
Does it feel sucky?
No.
No, shouldn't feel a thing.
Feels good.
Just feels good. She's just happy that she can eat nachos again.
Yeah, she's ready to get it off.
She's making butter.
And she's an ideal candidate because she's, you know, she's works out, she's fit, and she just, you know,
You never would have known that she had a tummy like that. Good-looking woman. 7:53 here. Let's pump up your lips. What do you say? The FDA has cleared one item used for lip injections now.
And the doctor who uses it, he says this could leave the world with more natural, natural looking, a bit fuller.
Well, what I love is we say natural-looking lips by injecting something into this not natural.
I think we're saying natural because for so long you see women who are like, it just looks like this part was flipped up or
like
something.
Lisa Rinna. Yeah,
to me, it's not worth it. So let's see. Hey, Jen. I'll tell
you about this about Lisa Rinna. When she had her lips blown up, then a couple of years ago, she said she was so upset what happened, and then I think she had to.
So she fixed them.
Because
for so long, then I knew her as the woman with the lips. I mean, you don't even know, and it wasn't in a good way.
Didn't know her name. Huh?
No, or her talent. She's. I mean, I don't. Yeah,
Lip woman.
Yeah, even on Dancing with the Stars, I remember. I would think.
She's married to that Harry Hamlin guy, right?
Yeah, I would not be the one to know. Even Meg Ryan. Same thing with Meg Ryan. Like I think that sometimes.
Oh, I love Meg Ryan when she was natural. Now,
but see, I
what's
just
going
feel like
on there?
it goes. Sometimes folks go too far.
She went too far. She doesn't even look like her anymore.
A human. You know what it was too about her? She had that sweetheart charm, like this, like.
When Harry Met Sally.
Yeah. Just like just a cute girl.
I interviewed her quite a few times, and
like that, or
I was in love with her.
Yeah. Was there? Yeah. It just, you know what it looks like? It looks like I want to take some of the air out of everything.
I interviewed her before. She looked like a koi fish.
A koi fish.
Yeah. Now, who's Taylor Armstrong?
Taylor Armstrong. The Real Housewives of Beverly Hills.
It.
She's the one. Remember, her husband just committed suicide.
Yes, I do. Now, are hers? Do we know that?
Now,
hers
you guys,
are fixed?
here's my thing. I can't tell with that one. Is that those not her lips?
Maybe that was part of one of the shows. I don't see that particular Real
Clearly,
Housewives.
we wouldn't have her as on a graphic if she didn't have something done. Now, if that's the way it looks, then I'm okay with that.
It's pretty good.
I'm okay with that.
But like in Lisa Rinna's case, they got too big. You got to be careful. But I think she was doing collagen. I don't think that's what Jen is using.
No, and with this one too, I mean, that's a little bit more of a cosmetic procedure. Apparently, what we're trying to hook up with Jen here is something that you can get it done in 15 minutes. And from what we hear, Jen, now once you do this, well, I'll just let you take it away.
Okay, so before we get to the lip thing, and you guys have explained it so well, we want to have the reveal or the after on our Coolsculpting. So you've been sitting here for about an hour. Dr. Bloom is going to pull this off. We just want to show you what this looks like after she's done. And basically, they're trying to break the seal now, and look at that. So that literally looks like
stick of butter.
A stick of butter. And so that...
And it feels cold. It's cold.
Okay. And it feels chilly to you as well, yes?
Are you serious?
A little bit numb.
Hey, Jen, if we have people that have joined us in the last hour, what did you do last hour? We should have set this up for you.
Okay, so what this is that this lovely, lovely lady basically wanted to get rid of a little bit of tummy fat. And so what Dr. B and Dr. B, Bloom and Bernstein did, you guys put this Coolsculpting machine, and we can show the device that you just pulled off of her. You put that on her for about an hour, and then what will happen is all these fat cells are being killed, and her body will flush them out over the next couple of months.
Yes, that's exactly right.
It's as if I went to Yale Medical School like you.
That's for sure.
So we're going to walk, and you look awesome, and I can't wait to see you get rid of all that stuff.
Just
yes,
real quickly, so what were we left with there? Because, okay, never mind.
That is a bunch of dead fat cells that have gathered together
roll on her
in one.
Tummy.
Yeah.
Exactly. And then what will happen is throughout the next couple of months, can I just say it? She's going to she's going to poop it out.
Okay, I got it.
Yeah?
It's
Fat
absorbed back
soluble
into
things
her
leave
body.
the body
She
that
gets it
way.
Yeah.
Water soluble things leave the body as water.
As water. Like, go into the bathroom.
Yeah,
That's what she's doing. So we're walking through here, okay? And what we're doing now is the lip pumping thing. And one of the things that we want to talk to Dr. Bloom about is this. So when we look and good morning, by the way, Skylar.
Good morning. How are you?
Oh, we're great. Okay, so Skylar is going to be getting this done. And we saw the pictures of Taylor and of Meg Ryan and of Lisa Rinna. And my goodness, we don't want Skylar to look like any of those
No,
people.
please. No. My mother always said, please don't look like a duck.
Okay, so we're not going to have her look at a duck. As we look at the 3D image of her before, there's 4 different things that you say we should be looking at. The first one is lip definition. What is that, Dr. B?
So lip definition is really the difference between the red part of the lip and the skin around the mouth. So we want to define that to bring that out so that when light hits it, it shows off better.
Okay, and we also care about the volume, the pout, and the proportion. And you say the number one thing that Skylar wants out of this whole situation is?
To look natural.
Okay, but you want a little bit of pout.
Oh, yeah, I want a little bit of pout. Sure, why not? Everybody wants a little bit of pout, right?
Okay, so you're going to do this now, and then when we come back in an hour, we're going to be able to see a big difference, and we'll talk about all 4 of the different things.
Absolutely.
Okay.
It'll look great.
So, ladies and gentlemen, say goodbye to the old Skylar, because we're going to say hello to the new Skylar coming up in a little bit. Okay? So, Mike.
Yeah?
It's just, again,
I can't wait
she
to
wants
see
her
what
lips
happens.
big, and Simone wanted her tummy small.
I know, we all want what we
everyone's
don't
dreams
have.
come true.
Isn't
and by
it
we,
funny?
I mean these guys.
We want
Thank
what
you,
we
Jen.
don't
We
have.
all want what we don't have. I was just confiding to Mike. I remember when I was at my dance recitals, because I have bigger lips, and I remember I would take the lip liner and do it on the inside, and I didn't want color. It's so funny how things work now. Please, whatever. I am who I am.
Smaller.
Yeah, but as a kid, you just.
That's right.
Yeah.
And the times have changed, too.
Times have changed.
Yeah.
My booty's okay and my lips are okay now.
Exactly.
Thank you, Jen.
Big is
Congratulations, Chanel, on your booty and your lips.
Okay, this morning we watched one woman plump up her lips. She could use maybe a little bit of it. We picked the right person, and so we want to reveal what she looks like now. And you also saw a woman freezing the fat on her tummy. What does that look like
What
now?
a day.
What we do here, and by we I mean Dr. Bernstein, Dr. Bloom, is we reduce what you don't want and we give you more of stuff that you do want, correct?
That's it, absolutely.
Okay, so let's bring Simone. So earlier what we did with her, and by we I mean you guys, Coolsculpting. Basically what people saw is that you froze some of the fat cells. There was almost like a tube, like a thing of...
it feels like a stick of butter, it really does.
But we want to show people that she's fine. She'll be walking out today and she's totally good.
Totally back to normal, and then it really does take about a month to start really seeing a difference. In fact, the week after can feel a little bit tighter, the pants, because there's some inflammation in there doing the work of removing all those fat cells you don't want.
Okay, so now we're going to do a little bit of before and after with Skylar. And what Skylar wanted was she wanted fuller lips, but she did not want to look like one of the Real Housewives or Risa Rinna in the Bad. Okay?
You got that right, girl.
Okay.
Even though I am a Real Housewife, I didn't want to look like one of those.
So look at the camera, and we'll be able to see the before and the after there. And the one thing, Dr. Bloom, that you were focused on, which sometimes you don't focus on, is her upper lip, correct?
Right, you want to make them proportionate. Basically, the upper lip should be about 1/3 of the total lip volume and about 2/3 for the lower lip. We gave her some definition, a little bit of fullness, and some pout. We rolled the lip out a little bit to give her a little bit more lip show.
Okay, so you have this amazing super duper 3D machine, this Vectra, and that's what we're going to look at here. Why do you need this camera, this 3D device, to see what you have done and what needs to be done?
Well, because what you're trying to do is look at volume, right? Yeah. So Canfield Scientific got this Vectra machine here, which is 3 cameras at once to show you a 3-dimensional view. It even comes with 3D glasses, which you can really, really see.
I know that you are a super laser dork and you love that, but how does it help your practice? How does this help you treat patients?
It really helps you see the before and after in terms of volume, of size. You know, it's easy to photograph color, but when you're trying to photograph volume, you really need a 3D system like this to see if something's really working.
All right, so you've seen the after. You're not going to be that puffy for the rest of your life. How do you think it looks?
You know what? I love it, and I've been told that I'm a little bit swollen right now, and I'm sort of talking funny because it's a little numb.
It doesn't sound so funny, though.
Okay, good. Okay. But so this is going to go down even more, but I look in the mirror now and think it looks very natural, and it's sort of, I think it sort of helps proportion my whole face.
You're a bit of a supermodel.
Yeah.
I love you. All right, so gang, that's what we've done. We've done a little bit, a little, and the thing is, you guys do a little more than more. Less is more in your
Jen?
Absolutely, you can always do more.
Yes.
Can't go back.
Are unanimous? We're unanimous. We give you gold stars, A pluses,
gold stars, A pluses.
Amazing. For both.
Really?
For both.
Yes, thanks, Jen. It's 9:51.
She's like surprised. I got an A?
Yeah, an A. And if you want prices, go to our website, myfoxphilly.com, because I'm getting a lot of tweets about price. Do you recognize that?